Thank you, and good afternoon, Madam President. Madam President, I rise in support of the emergency certified bill before us today. The debate here today, which has been a good one, though it's a bit frustrating to me because I feel a sense of deja vu, but with moving goalposts. If we start from the beginning, when COVID was brand new to us and hit us in Connecticut, we were all united. The governor declared his public health emergency, and the 6 legislative leaders and 4 leaders of the Public Health Committee met for the first time ever to affirm his decision, though we could have rejected it. About 2 months later, I recall the politics started creeping into the debate, with the public saying COVID was just the flu, just a cold, and we should gather to catch it like people gather to catch the chicken pox so we can have lifetime immunity. As people were dying, it was apparent none of that was true. Misinformation and disinformation was now mainstream. The next time the governor asked for an extension of his public health emergency, the group of 10 met and debated. This discussion was all about masking and opening up the state. The vote was no longer unanimous, and mind you, Alpha was still dominant and vaccines weren't authorized yet. The legislature came back into session in 2021, and we heard from the public and others that the legislature needed more of a say. So we made the changes to the law for COVID. The governor would be able to declare or extend his emergency, and legislative leaders were able to veto any order within 36 hours. Do you know how many were rejected? Of the executive orders, 0 were rejected. In June and September, we heard from some that the governor is taking over and running the state by fiefdom, and it was time for the legislature to take control. Mind you, we just had a very busy session passing hundreds of bills in a bipartisan manner and a biennial budget. Plus, we heard COVID was in the rearview mirror, and the emergency, quote unquote, is over. I remember, actually, that this was just before Delta and before anyone had even contemplated Omicron. Could you imagine if we let the executive orders expire? The legislature was not constitutionally in session, so that would have meant SNAP funding, the eviction moratorium, vaccine availability, and COVID testing would have ended just like that. So today, again, after hearing the governor is in control and the legislature needs to exert itself further, we will adopt a legislative resolution on a public health and civil preparedness emergency. Not the governor, the legislature will. On masking, we are voting for local control on masking in schools. We are voting on the remaining orders that help to stand up vaccine clinics, testing, and ensuring an adequate supply of healthcare professionals. We're doing exactly what has been asked, but the goalpost has been moved yet again. Where are we now? Are we out of the emergency? As much as we all want it to be, here we are yet again, and I don't think we're out of this emergency yet. 2,465 people died yesterday. 921,525 total in our country confirmed deaths. That's almost 1 million deaths over the last 2 years because of COVID. In the most recent data available, looking locally, according to the Norwalk Health Department, 0 to 19-year-olds, Madam President, account for 28% of all new COVID cases. The age category with the largest jump. According to the State Department of Public Health, from January 23rd to February 5th, 0 to 9-year-olds accounted for the second largest group of new COVID cases. Over 3,000 new cases in this age group. As to my vote, in leading up to today, I've worked to challenge my own opinion to make sure I was looking at this issue before us objectively and with the latest information. So I took the time to speak to a number of doctors and public health professionals to do a gut check. And to a person, a doctor at a major hospital, a retired pediatrician who is advising school system, and those at our children's hospital emphasized to me that while our positivity rates are down from where they were, they are still high. Additionally, because of the usage of all the home rapid tests, the positivity rate is actually higher than the doctors and public health officials would like because the home tests are not being reported. I have come to the conclusion that masking is going to be important in the short term. Hopefully not until the end of the school year, but we will have to pay attention to the numbers. One of the reasons I believe we've been able to keep schools open during January, unlike other states, is because we are highly vaccinated and have used a lot of good protocols to keep everyone safe, and that includes masks. Many other states' hospitals have had or have full pediatric units. If our infection rates wane, then by all means, we can advocate for no masking. This year, we have more flu because of less mask wearing, and as a side note, last year, not one child died from the flu because masks were prevalent. In the end, I do think staying the course for the time being is advisable, but allowing flexibility once we hear from the medical community that transmissibility is down to safe levels. Madam President, I would like to conclude with a message to those who may disagree with me and some of my colleagues on this issue. It reminds me of other debates this chamber has taken up, which has seen a lot of ugliness and personal attacks from the public. Agree or disagree with us, but the tenor, or those of us who disagree from the public, is frankly beneath any adult. The behavior of many who speak the loudest needs to be called out and rejected. Words matter. Name-calling, insults, and personal attacks have no place where thoughtful debate occurs. I have no ill will towards any individual who disagrees with my position, and I worry about the long-term effects of what I see as systemic bullying, calling into question someone's motives, and threatening behavior. We're all adults and can take whatever is thrown our way. I raise this issue because these are stressful times. People are tired and nerves are frayed. And again, I'm speaking of the public, not of anyone in this chamber. Just ask our medical professionals who have literally worked every day to keep us safe. We can disagree without being disagreeable and attack an argument, but not the person. We've heard a lot from parents who feel strongly, one way or another, but spoke publicly or privately in the most rude and inflammatory manner. We are better than that. Let's model good behavior for our children. Thank you.